with 2 liters of pee just spewing all over my clothes and shoes. The literal fibula is missing. Gone. Goodbye. So the doctor has us call the EMS. I then treated him for 10 visits and referred him back to his psychiatrist because I couldn't do anything about him being in jellyfish pain.
She got a call from her daughter, who's 19, that her boyfriend's mother got in bed with them.
There's so much to unpack on that one.
Do we start at the racist comment or... What's up, guys? Welcome to the Physio Diaries Podcast. We are your co-hosts, Dr. Melanie Ziaziris
and Dr. Alice Goshabatsky, where students, healthcare professionals, and wellness junkies come to get the inside scoop of the healthcare and wellness industry.
The podcast you didn't know you needed by your favorite travel physical therapists.
Hi, Physio fam. Welcome back to another episode, the podcast where we yap about the real, the raw, and sometimes the wild side of healthcare. In today's episode, we asked you guys to send in your wildest healthcare stories and experiences. You guys did not disappoint. But first, take literally 2 seconds out of your day to go rate us on Spotify and Apple. Ratings help us so much. If you want to do a good deed today, please give us a 5-star rating. Yes. All right, grab your coffee, put your feet up, and get ready for a roller coaster ride through the wild world of healthcare. So Mel and I thought it would be fun to do another one of these, submit your story. We've done crazy travel stories, and that went really well. We love hearing your guys' stories and love getting your input. So I personally have not really read through these, so we're giving you a live reaction right now. Mm-hmm. I'm excited.
Yeah, they're actually a decent amount. Yeah, I have not read through any. I don't know what is about to go down in the stories.
Let's just see. So we're going to just go through all of them and let us know, comment if you guys have had any crazy stories because we know that it can be wild out there. So the first one, this person was changing a patient and was a patient care tech, basically like a CNA. The patient was intubated, sedated, chest tube, etc. We rolled the patient, and while I was cleaning him up, I saw a cord coming out of his butt. I'm like, don't think that's supposed to be there. So I, a new to the medical field girly, pulled it out. Oh no. I feel like in healthcare, you should never pull anything out before you know for sure that it needs to be pulled out. The nurse looked at me like, what the fuck are you doing? And I'm like, this was up his butt. Turns out it was a rectal temp monitoring probe. It indeed was supposed to be there. We finished the bed bath and got him rolled back, and the Foley had to be moved. She hanged it to me to hang off the bed. Somehow the little spout opened and broke with 2 liters of pee just spewing all over my clothes and shoes. I panicked and plugged this is definitely some nurse inpatient acute care stuff. I panicked and plugged the hole with my gloved finger and bust out laughing as if I wasn't already embarrassed enough about the rectal probe.
That's
disgusting. This is why I knew I could not be a nurse. No. That just the vision in my head was enough to make me want to throw up.
This is why I don't want to be in the hospital, period.
Yeah, even as a physical therapist, acute care was not my jam at all.
That is so funny. I just
there's too much happening.
The pee going everywhere was the last straw for me.
The first straw was the rectal probe. See, anything rectal, I'm like, yeah, I remember working, actually, this sparked a story in my mind. I was working in Indiana as a student, and I got kind of floated to the ICU, and I learned what a rectal tube was. They are not very successful, apparently, according to my CI. Yeah. They don't stay in well. So a lot of the times when you mobilize somebody, they can become dislodged or there could be feces coming out. So we moved this lady, and we actually found out she also had C. diff. So we had to move her back. But yeah, being in acute care is not for the weak. I know a lot of therapists really like it, but personally, I know that was not my thing. I'm happy with outpatient.
Yeah, definitely.
This story definitely made me made me remember why I like outpatient.
Yeah. All right, next story.
Next story.
We had another patient. He was driving and following another car. The car in front hit a deer. The deer flew over the first car, hit the next car where my patient was, and the deer legit broke through windshield completely, and with the speed also went through the back windshield, if I remember right, and internally decapitated the driver.
Oh my gosh. That's crazy.
This is not funny. This is like horrific.
Oh
my
God.
God. That's like, so there's more.
There's more.
He didn't make it, but that was the most swelling I've ever seen.
Dang, you guys did not hold back. But that's crazy that that's people's everyday job
Oh
to
my
see stuff
gosh.
like that. Like,
Yeah, that
wow.
is wild. That's so traumatizing also.
I know. Yeah. That's crazy.
That is really unfortunate.
The fact
I don't
that
know.
it flew 2 cars, the deer went through 2 cars? Is that what they said? Because they went to the...
I think it went through the front windshield and then hit the back windshield. And then went through the back windshield.
The car in front hit a deer and then it flew over and then into their car. So they didn't even hit the deer, but the deer flew into their car.
That's insane.
That's crazy. Yeah.
Oh my gosh. There are so many deer where I'm at too in South Carolina.
Yeah.
And people are always like, beware of the deers.
Yeah. In Hawaii, it was like these wild hogs. Like, I remember when we got our rental car, the guy told me that a lot of people end up having to buy new cars because if you hit one of those wild hogs, they're huge. It will wreck your car. So,
oh my God.
They're lower to the ground than deer, at least, but they're big old pigs or hogs or whatever.
I don't like hogs.
Yeah, people go like hog hunting and stuff over there.
Yeah.
It's like interesting. Yeah, but that was a wild story. Wild. Okay. That's all I have to say. Next one. He was riding his bike. This is the continuation of the same story. Let me see.
No. It just
okay, new one. Okay, so he, maybe patient, was riding his bike and got hit on the road, and a family member found him in the ditch. The patient had such bad injuries to his leg, crushed femur, meat grinded. Feel free to replace this description. I'm tired. Okay. Tibia and fibula and somehow still had pedal pulses. How is that possible? I don't know.
Crushed
Please
femur,
explain.
But still had
pedal pulses.
Grinded. What do you mean meat grinded?
I think they literally mean meat grinded. Anyways, we get them stabilized and straightened. Good. And blood pressure under control. X-ray comes and shoots the leg. The literal fibula is missing. Gone. Goodbye. So the doctor has us call the EMS from the scene.
Wait, they said gone. Goodbye.
And have them go back to the scene and find the bone. And they bring it back. Excuse me? Wait, what? Not sure if they ever saved the leg, but hopefully saved the femur. What?
The way they said the fibula's missing, gone, goodbye. Literally no fibula in this person.
Like, it just literally shot out of the leg. That's crazy.
I'm so curious to know what happened to this person. Like, I feel like we need an update, but I don't think that
is the fibula back where it needs to be, or that is crazy. They actually went back to the scene and found the bone and brought it back.
Yeah.
Wow. I don't know. Yeah, I wonder if it was like in pieces or if it was like just all solid.
Gosh.
Yeah,
that is wild. So some of these things are just so crazy. Like, you can't just not laugh, you know? Like, you got to laugh.
That for me is my defense mechanism is laughter. And that's the bad thing is like when stuff like would happen inevitably in inpatient rehab or acute care, which are both settings I worked in. My instinct is to laugh when I was either uncomfortable or, like, overwhelmed, and I was like, I promise I don't find this funny in any way,
Yeah.
but this is, like, the only way I know I can, like, make this lighter, like, the situation lighter. But
Yeah.
yeah, these are wild. I know this is probably from a nurse is my guess, because this is some
You never
wild
know.
stuff, but you never know. Physical therapists too would treat this kind of
I
stuff too,
mean,
but
I'm sure even
yeah,
ortho docs or people, I'm sure they got some wild stories about
I
bones.
know. Yeah, imagine this being your, like, everyday is, like, anything could come through those ER doors, you know?
Yeah. Yeah.
Like, that's so wild.
I feel like we need more realistic medical shows out there because the hospital is just a
Yeah,
wild place. And a full moon
yeah.
just happened too, so I can only imagine what happened in the hospitals this week or past week.
Okay, I could have sworn it was a full moon a week ago
It was.
because it
It
was
was
a week
this week.
ago?
It
I thought
was
it was,
during
like,
the week, I think.
today or
No,
yesterday.
I'm like, where's my phone? In front of my face. It just passed
Okay, because things I
because
don't know if it
I
was
think it was
daylight
like
savings.
Tuesday. It
Okay,
was daylight
Tuesday.
savings also.
Yeah, I feel like
Yeah,
everyone's just
it
been
just
so
passed.
thrown off. Like, I don't know about you, but this daylight savings has got me messed up. I don't know. I
Really?
haven't been sleeping as well. Like,
Really?
things just have been crazy, but I don't know. It
Oh,
might be also like the upcoming move. But I was talking to like my coworkers and they're like,
true.
yeah, something's off. And this was like maybe a week or two ago. And we were like, is Mercury in retrograde? We looked it up. No. Is it a full moon? We looked it up. No. I'm like, okay, then it's got to be something because we were all having like crazy weeks. So
Hmm.
something was in the air.
Maybe it was the energy of daylight saving and the full moon because the full moon that just passed, like it was during the week. It
Oh,
was
yeah.
supposed to be like a super moon. Like it was a
Okay.
big deal for the full moons.
Yes. Wait, what is a
I don't
super
know.
moon?
I couldn't tell
It's just
you.
extra
I
rare.
have no details. I just
All
know
right.
it's
We
extra
just
strong.
know it's extra strong. Something
Extra
is in the
strong
air.
energy.
I will vouch for that.
Okay.
There's been extra strong energy.
Yeah. Next
Okay.
story. Okay, this person said, I had an inkling as I was walking the halls to just check on this patient for some reason. I walked in. He was literally draped sideways over his bed. He had tried to get chair to bed after extubation on his own and literally fell into the bed.
Oh,
Sorry.
no.
Sorry. IVs everywhere, fully on the floor. Patient was prone and face was breathable. But I was like, what you doing? And he
Just
goes, well,
casually.
and he goes, well, I failed to get back into bed, as you can see, but I'm too weak to get up. So I learned my lesson, but I couldn't reach the button. So
Oh
now that you're
my
here,
gosh.
patients be doing the funniest things. Like,
Wow. Yeah. Like, you just think, how was this person living alone at home, you know, before they got to the hospital? Because, like, how? I don't understand.
it's just that situation I'm sure has happened to
All the
so many
time.
times, to so many people, like that. It
Yeah.
seems like a very common thing that would be happening in the hospital rooms.
That's why they push those bed and chair alarms so much. Like, they're so annoying, but
Mhm.
this is one of those instances, you know,
Can't trust
this
no patient
man.
out here. Can't trust
No.
nobody in their rooms.
Oh my God, fully on the
Mm.
floor. Like, so many safety precautions out the window. Dang. Okay. Well, I hope that person was okay and you got him off the floor just fine. This is what I did like about acute care. It's unpredictable. And sometimes I like that, you know, like an outpatient, it can get a little bit more routine. Like you see the same kind of typical diagnoses every once in a while. You'll see something like out of the blue that you didn't think you would see. But acute care, you might walk into someone's room and you might expect one thing, just doing your chart review, and walking into something like completely different, which brings me to one of my stories. So
Okay.
I think I told you this before. I was a student in it was acute care in a hospital. It was a small hospital. I walked into this patient's room and based off of what I knew, he was at the end of life. You know, he had
Sure.
end stage heart failure. So in your mind, you're thinking, okay, they're on Dilaudid. They are very heavily medicated. And I'm just expecting someone to be just laying in bed, because
Mm.
what else would they be doing, right? They probably don't have a lot of energy. I walk into this room and this man is like practically pacing the room, running, and he's telling me, he's like, I want to leave the hospital. And I'm a student at this time, student physical therapist. And my CI goes, you got it. He's pretty easy. Like, you've got it from here, right? I'm like, yeah, I think so. So this guy basically asked us, he was like, could you rip out my IV, please? Like, I don't want to be here. I am dying. I want to go see my brother and I need to get out of here. And I was like, okay, like, you need to talk to the nurse. I'm just a little baby PT student. I have no power here. I will not tell you
Yeah.
what to do. And we just kind of, did nothing with him. But we decided to check up on him the next morning. And I was just curious, how is he doing? Because that kind of person sticks in your head. You're like, okay, why are you here? You should just go do whatever you want to do. And the next morning, we read the notes, and the guy, a few hours after we left his room, pulled his IV out on his own,
Mm.
grabbed all his belongings, and left the hospital. And apparently, nobody saw him leave. And I
What?
was like,
How?
I think that nobody saw him leave. And the guy left. And to this day, I'm like, I just hope this man made it to Colorado or wherever it was, like,
Oh my
to
gosh.
go see his family. But
Mm.
that was like an instance where I was like mentally prepared for one thing. And then I'm like, how is this man literally in end stage heart failure and on Dilaudid and like moving and pacing around this room? So acute care is just like a gamble, which
Yeah.
kind of was fun. And I would tell myself I'm like in one of those like healthcare and medical dramas shows, and it made it more fun. Or I guess more like tolerable to like process everything that you're seeing,
Yeah. I was trying to think back at my acute care clinical,
Oh, I forgot you
but
did an acute care one too.
we all had to.
Well, during our year, they did some like they
Oh, I
accepted
forgot.
sniff as like an acute care
Yeah.
one.
Yeah.
Yeah.
But I have like a very little recollection. I feel like I blacked it out. I like hated being in the hospital.
Was yours a shorter one? Was it the 6 week or was
Yeah,
it 13?
6 week.
Okay.
6 week, yeah.
Yeah, we all
Yeah.
tried that first clinical. We all tried to do acute care because our first two were
Yes.
6 weeks, and then the last
Yeah.
ones were like longer.
Yeah.
Yeah.
Okay. Next story.
Okay. Oh, I did read a bit of this one earlier. Okay. So I had a 7 a.m. eval on my birthday. First of all, I'm so sorry.
Yeah.
That sounds dreadful. I go into the eval at 7:20 because shockingly they are late. So I have 20 minutes for this eval. I'm talking to this man who's in his mid 30s, and he is listing off a list of comorbidities, including a list of issues that haven't been resolved by specialists. He's coming in for back pain, so I ask him if he can describe what his pain is like. He says, well, I feel pain very differently. I feel in color. Okay, so I ask again, what does it feel like to you? He straight up says, like a jellyfish. Okay,
Like a
cool.
shock.
So, yeah, I say it's like an electric shock, thinking it's nerve pain. And he says, no, like the color. His wife is in the corner, nodding along, like this makes complete sense, all the sense in the world. So, to clarify, I ask, like clear, your pain is clear. And he says, yes. I then treated him for 10 visits and referred him back to his psychiatrist because I couldn't do anything about him being in jellyfish pain.
I
I
have so many questions.
I do too. I wish
just
I
don't
could have
get
been
it.
like a fly on the wall in that session, because I've had people describe pain in so many different ways. Like
Yeah.
I had a patient one time describe her pain as spicy seeds. But to me, when someone says something like that, it actually helps me really visualize what they're feeling.
Yeah.
Like spicy seeds, like
Yeah.
tingling, like shocking, burning. That makes sense. Jellyfish pain, if he's not describing a shock, I'm like, I don't know what that means. Like clear pain?
But like clear? Yeah, like what do you mean
Yeah.
by clear? Like
Yeah.
I guess like a red could be like burning, orange could be like burning sensation. But
Yeah.
clear? What do you mean by clear? That's not a sensation.
And then at 7:20 in the morning, I feel like it would be really hard for me to try to understand this.
Yeah. I would just be like, okay. Yep. Gotcha.
What kind of pain are
Great.
we feeling today? What color is it? Yeah.
Oh, that's so interesting.
Yeah.
I had a patient really recently say when I dry needle her, it's wasabi.
Okay. No, but that makes sense. That's like spicy
Yeah.
seeds. Like
Yeah.
wasabi.
Yeah.
I get that. That's like
Yeah.
wasabi is like a subtle burn, you know?
Yeah.
Like
Exactly.
habanero, that's gonna
Yeah.
be really spicy.
Red
So
hot chili
funny.
pepper pain.
Yes, like that I get. But
Yeah.
part of the reason why we also, I think, wanted to do this is because I feel like this is kind of, when we in PT school, we had our psychosocial classes and we role played scenarios where our faculty was playing a quote unquote like difficult patient, somebody that was like stuck in bed and didn't want to get out of bed, or like different scenarios like that. Someone shares something really, really upsetting with you, and someone cries in your session. And I always thought like, we always thought in the moment we're like, this is like our BS class, like this is our blow off class.
Yeah.
But that class, I really think has helped me a lot because
Yeah.
we come across patients like this and people that describe things in different ways or, to have different experiences, and you have to maintain your composure, So
Yeah.
now I'm like, dang, they knew what they were doing with that one.
All right. Next story. All right. First ever contract. Get there for my first day. The receptionist doesn't know who I am or wasn't expecting me.
Oh,
Red flag. I asked for the director of rehab who interviewed me, and she said she quit yesterday and just left.
oh my.
They checked the schedule, and I had 16 patients my second day with no one to train me on anything, including documentation. Told me to figure it out. See, red fucking flag. Oh my gosh, that sounds like a
Man.
terrible contract. And like, who was the recruiter, right? Like,
Right.
what was going on in the background here? Because clearly no one was communicating shit. I mean, to get there and they
Yeah.
don't even know who you are, like, I would be like, oh, hell. Like, that's going to
Yeah.
be not great.
That's unfortunate because that's not very common, first of all, if you guys are listening to this.
No.
It's not common to have this experience. But I feel like things like that make people not want to do travel. But you can always leave a contract. Like if it's not what you signed up for,
Yeah.
in the interview they promised one thing and then it was not the same, you can always leave the contract. Same
Yeah.
as I think them being able to pull out a couple weeks before if they don't need you
Yeah.
anymore, but it's so rare. But that's crazy. I can't imagine. I'd be so stressed out.
That just sounds like a nightmare contract. Like, I don't know
Yeah.
about you, but whenever I go, obviously different with internal, external, but when I go into all clinics, like, they literally have a sign with my name and like things for me,
Mhm.
and like everyone knows that I'm coming, and like
Yes.
that's so unfortunate.
Sorry, that was my alarm to wake up this morning.
Well, you're up. That's good.
I'm awake.
You made it.
And I'm being productive.
Yeah.
Yeah, wait, that's actually really sweet. I feel like I
Yeah.
don't really have that as an external traveler, but they've always known that I was coming. That's for sure.
Like,
There's some clinics that do
expecting you.
more. Yeah, they
Yeah.
expect us. There's some clinics that do more that like have travelers commonly. Like they'll make a little sign with my name on it where my desk is. But
Yeah.
yeah, they usually know that I'm there and then at least somebody is there to like
Yeah.
give me the lowdown. Like
Yeah.
that 16 patients on day 2 is a little much.
That's
I think.
insane. I'm so sorry. I hope you left that contract early and found a better one and better recruiter because
Yes.
yeah.
Yeah.
Ugh.
Just better all around.
Yeah.
Okay. Next one. Had to treat patients post-COVID rehab, including pulmonary rehab, and got spit on multiple times. Later found out they tested positive again.
Oh,
Yikes.
icky. That gave me
Yeah.
chills, low key.
Yeah.
That's yuck. I'm
I
sorry you had
know.
to endure that.
Okay, so this is my maybe hot take, but I think
Oh,
spit,
we love a hot take.
sputum. Yeah, we do. We love a hot take on the Physio Diaries. But in terms of bodily fluids, like urine, okay, don't do poop, but phlegm and spit and saliva when it comes in your face, like that's not something that I'm gonna be able to handle very well. Like I am gonna
No.
dodge it
Yeah.
because, like they tell you try to maintain your composure. If something gross happens, like obviously the patient has no control over it. But I remember I had a patient that had a
Freak?
yes, a trach. It's too early in the morning to remember these
Yeah.
acute care things. And then there was like phlegm or sputum that came out
Yeah.
of it right at me, and I dodged that so fast.
Ugh.
And I felt really bad because I'm like, I'm sorry, the wife was there, and you could tell that I was kind of like thrown off by it. But what else
Squirmy,
was I
yeah.
supposed to do,
Yeah.
But for me, phlegm is like the worst, I think. I don't know why.
It's
It's
just, yeah, I
yeah,
don't like
I
bodily
don't do it.
fluids. Like, I don't wanna be
Yeah.
around it. I don't honestly, I don't
Yeah.
mind blood. I don't know why. I don't mind blood. But everything
Yeah.
else, absolutely not.
Yeah. 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 Blood is okay as long as I'm like properly, gowned and
Yes.
stuff. But
Mhm,
yeah,
mhm.
that's tough. Honestly, I salute all the healthcare workers that were working during COVID. I was a student during COVID, but I can't imagine like being in acute care and working directly with these patients. So
No.
kudos to you.
Okay, next one. One of my patients had to leave mid-therapy because she got a call from her daughter, who's 19, that her boyfriend's mother got in bed with them.
Excuse me?
That took a turn in a direction I was not prepared for. What?
Oh my
Hold
gosh.
on. I think I need to reread this one. Okay.
I wonder where this was. I'm very
So the
curious.
patient got a call from her daughter because her boyfriend's mother got in bed with them.
Yeah, that's
Yeah.
crazy. That's
That's
very odd.
red flags. So many red
Yeah.
flags.
Yeah,
Mm-mm.
patients have,
Nope.
like, left sessions early, but I've never had that one come up. No,
But
that's wild.
also, like, what was that situation? I would love to hear
Why
what
was
was
she
said
getting in
when this patient got back to
yeah.
PT. Like, what
She got
was
in
that?
bed with the daughter and her boyfriend, like, the 3 of them? That's weird.
That's so
I don't
fucking weird.
know.
I literally could never imagine that happening. Like,
Oh
could
my
you ever imagine that
gosh,
happening to you? Like, no.
no.
Mm-mm.
No, never. I don't see there ever possibly ever being a reason for that to happen.
No.
I don't know. I wonder where this was because that's
I know.
interesting. Yeah. And, like, what
Mm.
she did, what her reaction was.
I know. I want to know what happened.
Right. It was
Ugh.
like, "Oh,
If you know what
okay."
happened, tell us.
Yeah.
Give us the
Yeah,
tea.
I know. Okay. Um, in one of the clinics with multiple PTAs, they used to get in a yelling match in front of patients calling each other names because one told the patient to do something one way and the other said differently. All right. That's just
What?
unacceptable. Yeah, so I guess the PTAs had different treatment ideas or something. I don't know. And they would get in yelling matches. That's unprofessional. That's
That's just like, what is going on at that clinic? Like, that just doesn't even make
where
sense
is your
that
manager and
uh,
why
w-
aren't they
it-
managing the situation?
yeah.
Oh my
I
gosh.
am so curious to know what type of place this was,
Mhm.
but how does that even happen? Like, I just don't get it.
But you know that it's probably been going on for a long time if it's gotten to the point where it's yelling, screaming
Yeah.
matches in front of patients. Yeah.
That's
That's not
so
that's a
ick.
kind of hostile work environment.
That's a very hostile work
Yeah.
environment. If I was a patient, I would never go there if that happened. Like, these
Yikes.
people don't
Yeah.
know how to be professionals, and I
Yeah.
don't know.
Have you ever
Drama,
had
drama,
anything
drama.
like that happen in your clinic? Like where like
No,
therapists disagreed or yeah.
no.
Yeah.
And if they did disagree with something, they would never say it in front of a patient.
Yeah.
Like,
Okay, I
it
have a
would,
story actually. This
oh,
just reminded me.
yeah.
Not PT to PT. This was like across
Okay.
professions. So I had a
Oh.
patient that was coming in for ankle issues and foot issues. She also has foot issues. It was in physical therapy and then was also seeing her podiatrist. So her podiatrist taped her ankle and she immediately took it off. She was like, I didn't feel anything. It was just kinesio tape and she didn't feel anything and it didn't help her. She came later to me and was like, oh yeah, the tape didn't really help. And I was like, okay, like, can I try a different taping technique on you? So I used like a stronger Leuko tape on her and did this
Yeah.
technique. And she got immediate relief, had no more foot pain. Her like gait was so much better. And she kept the tape on. I was like, just keep it on as long as you can keep it on for
Yeah.
until it starts to peel. She went to her podiatrist later and the tape was still on that I did. And apparently the podiatrist was like completely destroying me and saying like, her taping technique is horrible. Like it's not even going to do anything, blah, 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 blah. Then he retaped her ankle and did this whole thing. It was like so much tape. And she said she took it off immediately because it was so uncomfortable. So she said that
Yeah.
my tape was more comfortable and she got more pain relief and I used way less tape. I don't appreciate when professionals, healthcare professionals, diss on other professionals, first of all.
Yeah.
Second of
Yeah.
all, who cares about the technique? It's how the patient feels, you know? And so
Mhm.
when she told me that, she came back and told me that, I was trying so hard to be very professional. I was like, you know what? Everybody has their own techniques. And to me, at the end of the day, as long as you feel better, that's my priority. That's what I said. And I kept it at that.
And then did she had you retape it then with your technique?
I didn't do it again just because I didn't want her to have tape on at all times. But she told me that she liked my technique better. And I was like,
Yeah.
yeah,
Thanks.
thanks.
I mean, that just sounds like a straight ego thing from that podiatrist. Like he just, or
Mhm.
he or she, whoever, just
Yeah.
wanted to be right, and the
Mhm.
one to do it. And they just
Yeah.
had to.
Yeah.
Yeah.
And I was like, and how did you feel? Like, I'm like, I don't care what they said. I'm like, how did you feel? And she
Yeah.
was like, your technique was so much better. It's like,
Yeah.
I know. Like subtly. But yeah, I am not about, putting anyone down in the healthcare field. Like we're all on the same team. Like, even if you
I mean,
genuinely think there's one better
publicly,
technique
though,
in
right?
it, yes, and in front of like to the patient. I also think that's a little bit unprofessional.
Yeah, totally.
Yeah.
I mean, there's so many other ways to word things and go about it. But yeah. Anyway,
Yes.
all right.
Agreed.
Last one that was sent in. My first clinical, my CI came and got me from the waiting room with the opening line, "You look like a Patel. Follow me."
Oh my
It,
goodness.
very uncomfy. I'm gonna
Yeah.
keep reading and see where this goes until
And
I
then we'll
say
debrief.
anything. Yeah. Then took me as an observer to her eval. 5 minutes in, she said, "In the second drawer of my desk, there's a small bag. Get me it." I get it. And she takes out stones and puts it around the room, dims the lights, and tells everyone to hold hands. Billed as eval and their activity. What?
Oh my gosh. Okay, hold on. There's so much to
Oh my
unpack on
God.
that one.
Yeah, I'm like, do we start at the like racist comment or the whatever this was
Oh
billed?
my gosh. And
Dims
this
the
was the
lights
first
and
clinical
yeah,
too.
first clinical.
Yeah.
Dims the lights and tells everyone to hold hands. I mean, that just doesn't even make sense. In what way does that make sense in physical therapy?
In what way are you doing any physical therapy?
That part.
I need to know more information about this.
I really need to know
Um,
more information about this. Whoever wrote this in, please tell us more.
yeah, this is crazy. I just feel like I would have left immediately, honestly. I would have been like, okay, see ya. I'm
Yeah,
not
I would have immediately reported it to like whatever school you're at.
right. Also, when she made that comment, yeah, that's just terrible. Like actually
Yeah.
terrible.
And like not
Yikes.
okay at all.
Not
Because
okay at
I can
all.
just only imagine if that's the first comment you're starting with, like what other comments were made,
Exactly. Right. That's crazy. And what's with the meditation session and the eval? I would have been so uncomfortable. I would have been standing in the corner. What is this? Like,
I also want to know what wording they put to bill it for therapeutic activity. Like, what was this wording?
I don't know. I don't know. Yeah, there must have been some really good documentation to bill that as therapeutic activity. I wonder what the
Yeah,
person was coming in for in the first place.
true. So
Like,
many
what was their
questions.
diagnosis? Yeah. What setting was this? Was this like neuro? Because I guess that would make maybe a tiny bit more sense, but still, that is not a great first clinical experience.
No, that's terrible. I'm
That
so
is
sorry this happened.
horrible. Yeah. Did you have any bad experiences in your clinicals or like bad CIs?
All my CIs were great, honestly. I really
Yeah, me too.
liked all my CIs. I had one experience, but it was with a patient. Um,
Mm.
which this I've seen controversy on this, but he was a VIP patient to the hospital.
Oh, really?
Yeah.
Do they label
hmm
them as VIP?
Yes, they do.
Wow. Okay,
And he
interesting.
was not a famous person. He just a rich person that donates to hospitals.
Oh, of course.
That type of
Gotcha.
VIP treatment. Yeah.
Mm.
Um, and they had a like heart procedure. So they had like the sternal precautions and incisions and whatnot. And I'm trying to put a gait belt on them. And they freaked out that I was
Mm.
putting a gait belt on them, saying that nothing can be touched in the incision. I'm like, yes, it's not going to be on your chest. That's not where we put a gait belt.
Mhm.
And they were questioning why we have a gait belt. And I was like, well, it's for your safety and my safety. And this patient was like, "Ugh," I'm trying to remember. This was like so many years ago now. I'm trying to remember what the exact wording is, but it was along the lines of, if you're too short to be in this job, then you shouldn't be doing it.
Oh
And
my gosh.
I was
What?
like, okay, I'm gonna go
How
get
did you
my CI.
respond? Yeah.
I just left. I just
Yeah.
was like, okay. And then I left
Were
to
you
get my
you were a
CI.
student?
Yeah.
Yeah. Oh my gosh.
Yeah.
That's so rude. So a couple of our friends are also more petite, small framed,
Yeah.
and I know that they also said that they get those comments too. Like,
hmm
"Are you, like, strong enough to pick me up, little lady?" Like, things like that.
Yeah.
And you were already in a setting that you didn't wanna be in, so you're like,
Yeah.
"Alright, I'm out."
Yeah. I was kind of just like, this fucking entitled rich man. I'm gonna just, I don't care. I
Yeah.
don't care enough.
Did you guys have to go back and see him or no?
I did not know.
No.
I don't think I'm trying to. I don't even think my CI did actually, because she was
Yeah.
like, "This is unacceptable."
Yeah, that is
Yeah.
absolutely unacceptable.
Yeah.
My
But
goodness.
yeah,
The
it
audacity people
happens.
have,
Comments are made.
yeah.
Yeah.
Comments are made, and
Yeah.
I feel like in any setting, comments are made, like weird
Mhm.
comments, uncomfortable
Yeah.
comments to both like men and women, but you learn to stand up for yourself, I feel like. Like my first year as a
Mhm.
PT, I would take those comments and I'd be just brush them off, even if they made me really uncomfortable. And now
Yeah.
I'm like, you make one comment, you're already on my radar. You make two comments that make me uncomfortable, and
Mhm.
I say something, and you still don't stop. I'm transferring you over to a different therapist. I
Yeah.
don't put up with that anymore. But as a
Mhm.
new grad, I feel like, and definitely as a student, you're just like what?
Yes, for
You're just like,
sure.
I'm gonna go grab my CI. Like, where's my mommy? Yeah, and
But yeah,
especially
I
because
feel
you
like
knew they were, like, a VIP, and you're like,
yeah.
"What do I do?"
Okay.
Yeah,
But I don't really have too many like crazy stories. Like some of these stories were wild, and I've just
yeah,
never experienced anything like to that capacity of
I know.
wildness. But
Yeah, well,
yeah.
let's hope to keep it that way.
Yeah. Those are some good stories. They went in
Those
so
were
many different
good.
directions. Like,
Yeah,
I wish we had some updates on some of them.
I know, I know. I'm, like,
Yeah.
going to ask people for more details.
Yeah, definitely. All right. Well, that wraps up today's episode. A huge thank you to everyone who shared their stories. We couldn't do episodes like this without you. Healthcare is full of chaos and compassion, and hearing your experiences reminds us that we're all in this together. And sometimes you just gotta laugh and brush it off. um, But as always, please rate our podcast 5 stars with your 5-star girlies. Make sure to follow so you get notified when next week's episode drops. All right, until next time. Bye, guys.
Bye.